Hepatitis is simply inflammation of the liver and is caused by a myriad of factors. This can lead to either an acute hepatitis or a chronic hepatitis. So what's an acute hepatitis? We say acute hepatitis when there is some immediate damage to the liver, and this is normally seen within 6 months, and then there's resolution of the damage within the 6-month period, such that when you do your liver function test, it should normalize after 6 months. And when this damage seems to persist beyond the 6-month period, also evidenced by your liver function tests with persisting deranged parameters, we say this person has transited to a chronic hepatitis. There are a myriad of causes, as mentioned. The common ones are infectious causes, and what is implicated here mostly are the viral hepatitis. So the viral hepatitis, there are about 5 strains that have been identified, and these strains are hepatitis A, B, C, D, and E. And they all have different modes of transmission and cause different severity of disease. So B and C in particular have been implicated in chronic illnesses, and combined have been shown to be the major causes of the liver cirrhosis, liver cancer, and hepatitis related deaths. The other viruses also implicated here are Epstein-Barr virus and CMV, or cytomegalovirus. Obstructive jaundice, autoimmune hepatitis, and some metabolic disorders or genetic causes, like the Wilson's disease, among others. We also have drug-induced hepatitis, and this is mostly seen in certain overdose of certain medications, like acetaminophen. We also have toxins, okay? So, and what do we see? Commonly alcoholic consumption, so alcohol abuse normally leads to hepatitis. Certain herbal preparations mostly lead to much work on the liver and also leads to hepatitis, and certain poisons. The person may present with non-specific dyspeptic symptoms. So the person could present with nausea and or vomiting, feeling of bloating in the abdomen, loss of appetite, complaining of pain in the right part of the abdomen. And when you examine this patient or this client, you would observe that there could be yellowish discoloration of the eyes, which we call jaundice. It could also be yellowing of the skin. You may also feel pain when you palpate the right upper part of the abdomen. You may also feel a mass as well. When you also examine the urine, you might see that the urine is dark colored as well. And then the treatment depends on the cause. For hepatitis A and E, these are usually self-limiting and require no treatment. For hepatitis D, usually we give you some medications which we call interferons, and this helps in the management of chronic hepatitis D. For chronic hepatitis B and C, we normally give certain antivirals, which hepatitis C having some proven treatments. So if you have been diagnosed with hepatitis B, C, or D, I recommend that you see your healthcare provider for appropriate treatment and management. Complications include liver cirrhosis, liver fibrosis, liver cancer, liver failure, portal hypertension, hepatic encephalopathy, some bleeding disorders. So our prevention here looks at avoiding what causes harm to the liver. So we look at avoiding what we call the hepatotoxic substances.
the drugs that are toxic to the liver. So alcohol abuse is one. So you either avoid it completely or reduce it to the barest minimum. Avoid certain medications, common over-the-counter medications like acetaminophen, which is very toxic, and make sure that it's toxic at higher levels, so make sure you take it under prescription. You avoid abuse of herbal preparations, which give the liver so much work to do and sometimes tend to cause damage to the liver, so avoiding abuse of herbal preparations. Now, avoiding sharing sharp objects. Hepatitis B, which is the leading cause of liver cancer, it's implicated in use of in sharing sharp objects which have been infected, unsafe sexual intercourse. Avoid sharing needles or sharp objects as seen in IV drug use. Okay, so this is very important, and as we mentioned, hepatitis B is the leading cause of liver cancer and is mostly implicated here. And also, vaccination is very key to protect you from acquiring some of these infections like hepatitis B. In conclusion, take action now, get tested, protect your liver. I am Dr. J, your Dr. Aid for today.